Hello dear friends, welcome back. We are discussing about the human muscular system. So up to now we have discussed about the muscles of the shoulder region. We have started discussion on the muscles of the upper limb, in which we have discussed about the muscles of the pectoral region, the muscles of the back region and the muscles of shoulder region. Now the fourth region in your upper limb is your brachium or arm region. And what are the muscles in this region? Let's go for it. First of all, we should know that our arm or brachium is divided into two compartments, the anterior compartment muscles and the posterior compartment muscles. And in this image you can see clearly that here, if you follow the cursor of the marker, here we have a bone which is called humerus bone, and anterior to the humerus bone these muscles and posterior to the humerus bone these muscles. So our arm is divided into two compartments, the anterior compartment and the posterior compartment. In the anterior compartment there are three muscles, in the posterior compartment there is only one muscle. In the anterior compartment there is biceps, there is brachialis and there is ChorachoBrachialis, and in the posterior compartment there is only one muscle which is called the tricep muscle. I hope you will remember these points which I haven't written here, but I told you that the arm region is divided into two compartments, anterior and posterior. The muscles which are anterior to the humerus bone are the muscles of the anterior compartment, and the muscle which is present posterior to the humerus bone is called the posterior compartment muscles. Now in the interior compartment muscles of the arm, the first muscle is the biceps brachii, or we can also call it biceps brachii. So let's introduce it. This muscle, it is the muscle of the arm region, right, in the interior compartment of it. Its shape is the biceps brachii has a spindle and fusiform shape, right. You will see the shape here, you can see this is fusiform shape. And what is its location? The biceps is a large thick muscle on the ventral portion of the upper arm, right, ventral or anterior portion. I hope you learned this point a little bit right now before. So ventral portion. Now what is its origin? The bicep muscle has two heads, the short head, right, and then there is the long head. Let me bring it down. There is short head and there is long head, right. The short head of the bicep brachii is gets its origin from the apex of the coracoid process of the scapula, right. This is coracoid process of the scapula, right, and this is the apex of it. So this is the short head of the bicep brachii muscle. It gets its origin from the apex of the coracoid process of the scapula. And about the long head of it, it arises from the supraglenoid tubercle of the scapula. Supraglenoid tubercle of the scapula. So the bicep brachii muscle gets its origin from two parts, the coracoid process of the scapula and the supraglenoid tubercle of the scapula, right. Next, what is its insertion? The bicep brachii muscle, bicep brachii inserts into the radial tuberosity of the radius bone, deep fascia of the forearm. Insertion of the bicipital aponeurosis. So here is the insertion point. It inserts into the radial tuberosity of the radius bone, right. What are its actions? Its actions are the flexion and supination of the forearm at the elbow joint. There are also weaker flexion of the arm at the glenohumeral joint, right. Let me delete this. Okay, so what are the actions? The flexion of the forearm and supination of the forearm, it helps, and a very weaker flexion of the arm also. So we just say that it helps in the flexion and supination of the forearm. What is its blood supply? It is supplied with the branches of the brachial artery, right. And what is its innervation? It is innervated by the musculocutaneous nerve which comes from C5 to C5 and C6. So here you can see in this image, this is the origin and this is the insertion in these images, right? Let me show you here, right? This is the origin and this is the insertion, right? And this is this shows the bicep muscle, right? Here also biceps muscle, and here is the innervation, right? And here is the blood supply of this muscle, right? So I hope you enjoyed it. This was about the bicep brachii muscle. Now the next muscle in the anterior compartment is the brachialis muscle. I will not discuss the posterior compartment muscle. I will discuss the tricep muscle in the next lecture. There is the brachialis muscle. The brachialis muscle you can see here, right? It's a very short muscle, right? It is located anterior to the humerus bone, right? So brachialis muscle, the brachialis muscle is the anterior inferior area of the arm, right? Its shape is fusiform. It is located in the interior, it means flexure compartment of the arm, deep to the bicep brachii, right? Where does it arises? It gets its origin from distal half of the anterior surface of the humerus. Distal half of the anterior surface of the humerus. And what is its insertion? It inserts into the coronoid process of the ulna, the tuberosity of the ulna, right? So here is the coronoid process of the ulna, right? There is the tuberosity where this brachialis muscle inserts, and this is its origin point. What are its actions? The brachialis muscle provides flexion of the elbow at all physiologic positions and considered as the purse flexure of the forearm. So it's the flexure of the forearm. And what is its blood supply? It gets its blood supply from the brachial artery, the radial recurrent artery, right, and the branches of superior and inferior ulnar collateral arteries. So here I have shown the blood supply. And what is the innervation? It is innervated by the musculocutaneous nerve C5, C6 and a branch from the radial nerve which arises from C7 vertebra. So here you will see in this diagram all the important points about it, the origin, the insertion, right, and the blood supply and the innervation of it, right, friends. Okay, now the next muscle in the interior compartment of the arm region, that is your that is your ChorachoBrachialis muscle, right? So ChorachoBrachialis muscle is the muscle in the interior compartment of your forearm and this of your arm, and this is the ChorachoBrachialis muscle here. The ChorachoBrachialis muscle is a long slender muscle of the interior compartment of the arm. It is pyramidal in shape, right, and it boundaries the interior wall. Okay, its boundaries are the interior wall. There is pectoralis major muscle and the pectoralis minor muscle. Here is the pectoralis major and pectoralis minor muscle. So interior to this muscle there are pectoralis major and pectoralis minor. In the posterior wall of this ChorachoBrachialis muscle there will be subscapularis muscle and teres major and latissimus dorsi muscle, right? So it means that interior to this muscle there is pectoralis major and pectoralis minor. Posterior to this ChorachoBrachialis muscle there will be subscapularis, teres major and latissimus dorsi muscle. What is its location? The ChorachoBrachialis muscle is located in the interior upper compartment of the forearm, right? What is its origin? It arises from the coracoid process of the scapula. You can see here coracoid process of the scapula. Let me go a little bit down. Here you can also see its origin, coracoid process of the scapula, and its insertion is in the anterior medial surface of the humeral joint, humeral shaft, interior medial surface of the humeral shaft. What is its actions? Abduction and flexion of the arm at the shoulder joint, abduction and flexion of the arm. What is its blood supply? It is supplied with the muscular branches of the brachial artery. So here is your brachial artery, it gives muscular branches, so they supply the coracobrachialis muscle. And what is its innervation? It is innervated by the musculocutaneous nerve, which comes from the C5 and C7 nerves. So there is the here you can see in this lower image the coracobrachialis muscle is there, and these are the branches of the musculocutaneous nerve which come from C5, C6 and C7. So they give branches to this coracobrachialis muscle. So friends, this was about the bicep muscle and biceps, brachialis and the coracobrachialis muscle. In the next lecture we will discuss about the triceps muscle. So see you guys there. Till then, Allah Hafiz.